couple of more questions about, are you sexually active?
Well, I do, but
Mhm.
you know, I feel so embarrassed doing with my husband.
That's absolutely understandable. But anyway, I need to explore this question if you don't mind. So, I mean, do you have any relationship with your partner?
Yeah, I'm married.
Oh, nice to hear. This is not now, please, Gus. Sorry, some men. I'm sorry. 5 minutes. 5 minutes. Give me. Sorry.
Oh,
So coming back to your child. Sorry. So no relationship at the moment, right?
yes, yes,
Good.
yes. Yeah.
Mhm. And does your partner have any symptoms at all?
Well, no, not at all.
Right. But anyway, it's not good, and definitely you need to receive some treatment to get rid of this. Do you have any bowel symptoms? I mean, constipation, diarrhea?
No.
That's nice. What about your fever? Is this okay?
Well, yeah, I have no fever at all.
Any rashes on your body?
Well, there's no rush.
Any changes when you breathe, when you go to the loo?
No.
Right. Any changes in your weight?
Well, there's no changes.
Great, it's nice to hear. So regarding your partner, I'm sorry that I need to ask this. I mean, have you changed, like, are you in a stable relationship? Is this right?
Yeah, I am.
For how long are you in a relationship?
Well, we've been together for like 3 years by now.
Oh, great. And definitely you're planning to have your children?
Mm, well, you know, I don't want any children yet, so I'm using the IUCD.
Right. And what do you do for work, by the way?
Could you please ask me again?
What do you do for work?
Oh, my work. Well, I'm a teacher.
Good. All right. And does this problem have any influence on your everyday's job?
Well, yeah, I feel less confident.
2 minutes remaining.
Right. Do you have any ideas what might be the causing of your problem?
I don't know, doctor. I really want to know what is going on with me.
All right. If you don't mind, I will examine you. So I will touch your tongue, I will take some observations, and we'll examine you per vaginal in the presence of chaperone, female chaperone. Is this okay for you?
What?
Okay. Thank you for letting me examine you. And you know what I'm suspecting at the moment, that you might have a problem or a condition which we call bacterial vaginosis. So this is not something very serious, and this is not sexually transmitted infection or disease.
Oh.
So you can be absolutely relaxed that this is not the fault of someone, right? And for this purpose, we need to treat it. I will prescribe you some tablets. We call them metronidazole. You will take them for 14 days. So I will write all the prescription, how to take and when. And the main issue that to get rid of this, you need also to change some your everyday habits or your hygiene. So I would recommend you to stop having bath and to swap it to having a shower if it's not a big deal. Why? Because it would be better if no other infection or no other flora will go to your private part. And please try to avoid, as minimum for the time of treatment, try to avoid these perfumes and bubbles. They
On to the
also
next
can,
station.
yeah, thank you
Thank
for your
you.
attention.
Well done,
Thank you,
Ella.
sir.
Thank you very much for taking the chance, and you're always very friendly. You always try to do consultation in a very friendly way. So definitely you've done very well. So I've written few things I'm putting in the chat box as well. And we will
Mhm.
be, definitely will be commenting on the positive findings and what you have done. So last, first of all, from the Maya to comment on the consultation, because she was acting as a patient, so she would know more what you missed and what you have done. So we'll start with the positive points in your consultation. Then we'll talk about the structure PLAB-2 wise, and then ask Savera that how did she like your consultation, how you can improve on. Then Ramesh and me will quickly do that, and then after that we'll go on further. Yes, Maya, you start, please.
Well, Allah, thank you for doing this station. It was really amazing. The way you started, it was really nice. Well, the thing is, I would like to say just one thing. You asked really well, like, for the track part, timing, relation, amount, and color. You didn't ask how much amount, but you just assume if it is like, same amount or is there any changes, you can ask, how much amount was it? You can ask it in the beginning like that. And you asked about relation, like, fever, smells. That was actually nice. You asked about it. And the next thing is every woman with a childbearing age, please ask about the menstrual period.
Yeah, period
Yes,
pap
last
smear,
menstrual period.
so poor. But when I heard, 2 minutes remaining, I moved on to management.
You run
It's
the
all
right.
right, yeah.
Yeah, yeah.
Yeah,
But
yeah, I think you did. Yeah.
I tried to be fast, to be honest. I tried to ask relevant questions, and it's impossible to ask everything.
And
I
also,
know, not all. I didn't ask everything. Yeah.
and
The gas
yes,
service
yeah.
disturbed me and took additional 20 seconds.
And well, yeah. And the next thing is, when you say coming back to that one, that was a little bit embarrassing for me, but it was all right. Well, and then the next thing is you asked well about, IUCD, blah, blah, blah. The way you asked it, it was actually nice. And your management was good. So and also you said thanks in the end. I really love it.
Yes, yeah.
Thank you.
Thank you. Yes, yeah.
Yes.
Okay. Yes, so I would like to hear from Savera. What do you think about this consultation overall? What positive things other doctors should adopt from Dr. La consultation? And then we'll ask, yes, Savera, what do you think as a GP?
Yeah. So Ala, you started really well. I was really impressed how you made the patient feel. She said to you that she felt embarrassed about it, and you made her feel very comfortable about it, and she opened up to you about her problem. So that was great. And then you asked all the relevant questions. I'm just not sure about why you asked about